this is the sort of first pandemic of the modern age in the era of the internet and social media. And so that we know that public health voice has only a certain reach, and we need to get on board other people, other influencers, people who can reach youth, people who are elders in the indigenous community, for example, who can speak to their community.
The challenges facing Dr. Theresa Tam are myriad. The doctor guiding Canada through the pandemic has faced allegations of mixed messaging, mask skepticism, and even outright racism. But Canada's chief public health officer says the biggest challenge is tackling the systemic issues that have meant some Canadians are suffering from the pandemic much more than others.
We haven't done enough in our systems to address the inequities faced by seniors, faced by some of our essential workers who are often low paid in racialized population, often women, and people living with disabilities have been disadvantaged by this pandemic.
Dr. Tam was speaking to her most recent report, From Risk to Resilience, covering how the pandemic has affected Canadians of every walk of life. But the differences in health outcomes are stark, with racialized and low-income Canadians overrepresented in COVID case numbers. Steps are being taken to address this, as the pandemic's urgency has encouraged cooperation between groups whose interests don't always align.
Very quickly into the beginning of the pandemic, many ministers of health, for example, in the federal government, the Minister of Finance, the Minister in charge of ESDC and Indigenous Service Canada are all at the table at the same time solving a complex issue. We need those similar intersectoral tables with the right leadership to carry on.
The report also says social cohesion, Canadians' ability to stick together, is key to ending the pandemic. That cohesion was tested earlier this year when Dr. Tam was targeted by Conservative MP Derek Sloan, who alleged the Hong Kong-born Tam was working for mainland China and not Canada. But Tam says she was paying more attention to her job than what people were saying online.
I do think that the vast majority of the Canadian population has been doing very well and is behind the public health response, and that just needs to continue. But and as an individual, I was really very, very busy just focusing on doing my part in the public health response.
The entirety of the interview with Dr. Theresa Tam is available online on our website. You can go there to hear her thoughts on disaggregated race-based data collection, vaccine development, and how some First Nations communities are flattening the curve better than the rest of Canada. In Ottawa, Xiaoli Li, City News.